Director of the Joje Medical Group, and today we're talking about your chance of success. Come for your fertility program at the Joje Fertility Center. My chance of IVF success at JAFC. Next, so we'll be looking at a brief introduction of the fertility center. Next, the Joje Fertility Center is a clinic that offers comprehensive fertility care to couples trying to achieve conception. So what that means is that um, clients who have been married for at least 1 year and our neighbors have not been able to achieve conception, they are our clients, and these are the category care of. Although under the Joje Medical Group, there are other aspects of medical care that we also provide. And a very important question in the mind of our clients when they come to us is, what is my chance of getting pregnant through IVF at the JFC? IVF means in vitro fertilization for our audience who might be new to this whole issue of human reproduction. So that is a major question in their minds. What is my chance of getting pregnant? And so that's what we're going to be um, looking at today next. So it's very important for you to know what your chance is. Like I said before, the big question is, what is my chance of IVF success at JFC? Okay, so next. So your chance of success depends on various factors, and these are some of the factors we're going to be looking at. It is important for you to note that no two patients have exactly um, the same chance of success. All right, and so when you come in for your treatment program, we want to know what your chances are. And let me first of all state clearly here that at the Joje Fertility Center, we are very, very conscious of of your success. We do everything to make sure that you attend to you. We we usually teach heavily towards options that gives you your best chance of success. Although sometimes those options, like Baby Fertility Center, is currently at 55.3%. That was our success rate, average success rate for last year. You would agree with me that that rate is not bad. It's a good rate, but we are trying to even improve on that because we want to give all of our patients a very good chance of becoming parents when they start their journey with us. God has helped us thus far, and we God has really been good to us. Also, what are the factors that affect IVF success? So, like I said before, the first is the age of the female couple. Why is it in the ovary? All right. Unlike the male, where every 2 months the new sperm cells are produced in the testes, in the woman, our eggs were produced when she was still in utero, when she was still a fetus, at about 24 weeks of gestation. That was when all the eggs were produced. And by the time she is born and she begins to grow up onto puberty and gets into the reproductive age, the cells begin to reduce gradually, they begin to die off, such that the quality of a woman's egg is solely determined by their age. The older she is, the less the quality. And that is why the threshold age for fertility for a woman is 35, That's because we have recognized and identified that once a woman gets to 35 and above, there is a significant drop in her fertility, and that is mainly due to the quality of egg. Now, embryo quality is determined by both the quality of the egg and the sperm, but the egg quality holds more significance, carries more significance, or has a greater impact than the sperm quality when it has to do with the quality of the embryo. So next, we are looking at the chance of success based on age. You see this diagram. It has the various ages and their success rates, and then you can see very clearly that once a woman age, how age determines the success rate. Less than 35 years, above 40% success rate and 31% live birth rate. As she goes above 35, 35 to 37, it drops. 38 to 40 drops further down and down. As once she gets into her 40s, there is a significant drop in her chance of success and life birth rate. That is why when a woman starts her reproductive career matters a lot. Matters a lot. Okay, so we have said how age affects IVF success. We said it affects the quantity and the quality of eggs. And it also, the quality of egg affects chromosomal abnormality. And chromosomal abnormality will affect miscarriage rate and also affect abnormality for the baby. What this simply means is that the older a woman is, the less the quality of her eggs. And this quality is um, based on chromosomal abnormality rates. Because the older a woman is, the more the chromosomal abnormalities, and the more the chromosomal abnormalities, the less the chance of success, the more the rate of miscarriages, and then unfortunately, the more the abnormalities that you will have with the baby. So this is how age affects the um, quality of eggs. Like I said before, um, the oocyte is one of the oldest, if not the oldest cell in the body. One of the oldest cell in the body. All eggs in the ovaries are produced by the time the woman is 24 weeks of fetal life. That means she's not born yet. All the eggs have already been produced between 7 to 20 million at 24 weeks, and by 1 to 2 by at birth that number has reduced to million. Then at puberty it has um, reduced further to 400,000, and then all through her reproductive um, career she releases eggs every month. Although it's one egg that is released every month, but the number of eggs that are recruited that starts the journey towards development and maturation is quite a number, from between 15 and 30 in some patients. But whilst only one egg will be released, the other will die off. All right, so that by the time she's approaching menopause, when the woman stops menstruating. And so you will notice that the age of menopause for women varies from 45 to as late as 55, 53, 55. There are some women who are 53, 55 are still seeing their period. What that means is that they still have some egg stores. So some women have their eggs depleted very early, and those women will have what we call premature um, ovarian failure or early menopause, while some will have a very significant delay. It means that their eggs were not depleted so rapidly. Again, you have a graph that shows egg quality by age. You see that as um, as the female age advances, the the rate of the number of eggs that she has reduces. Number of eggs with normal DNA reduces. Okay. Okay. So let's move to the next point. So how does age affect IVF success? We'll talk about the egg. All right, that is the first major factor that determines IVF success. But that is not all. That is not the only um, factor, as it has to do with age, that affects the IVF success. So you also have the uterus. All right, the the womb that would carry the baby. Age also does affect the womb and affect the receptivity of the endometrium. We have noticed that the incidences of uterine fibroids, of polyps, of adenomyosis, you find women who are trying to get pregnant, who are in their 30s, in their 40s, they have a high rate of uterine fibroids. A lot of them would have had um, surgeries, all right, and that with scarring of the womb, trying to remove fibroids. There's increased incidences of adenomyosis, and then you have increased risk of uterine adhesions due to previous surgeries like um, myomectomies, infections, previous terminations. So all of these factors do affect the IVF success rate, just mainly as a result of age. As a woman gets older, all of these factors begin to find significant prominence. Okay, you see a diagram here that shows the female reproductive system. You have the vagina, you have the cervix, you have the uterus, fallopian tube, the ovary. But what do you see significantly there that is not supposed to be there? Those are fibroids, uterine fibroids. They are present in various parts of the womb, and so by that you have different um, different positions. You have um, some that are outside the womb, and so we call them subserous. And then you have some that are inside the womb, and we call them submucosa. And some are found in the muscle, and then they are called intramural. And then some are um, found right inside the womb. All right. Um, this you have a pendiculated submucosa fibroids. And so, based on the position of the fibroids, um, you have you have these affecting the the success of IVF. All right. So that is how fibroid does affect success. And like I said before, these all are affected by the age of the patient. Okay, so this is a scan report of a patient who has a submucous fibroids. There are two scan reports there. You see the first one that has the fibroid that is being indicated by the arrow. And then the next one is when the fibroid has been removed, and you can see how the endometrium looks very nice. And you can see the endometrium. And when you do a transfer, the patient without the fibroid is definitely be more likely to get pregnant. Okay, so this diagram is showing a submucous fibroid at hysteroscopy. You can see how this fibroid is protruding outside the into the endometrium. So you see that structure that you're seeing that is on your left is the submucous fibroid. Now, if you do an embryo transfer and the fibroids are and the embryos are deposited on the fibroid, that patient is unlikely to get pregnant. But if it's deposited on the other side where the fibroid is not present, then the patient can get pregnant. And so that is why sometimes you know reproduction. I have seen pregnant, and so that is why if you have fibroids, it's a decision that we take very carefully because not all women who have fibroids should have their fibroids removed. It depends on the size, it depends on the location, and it depends on the history of the patient. All right, but this type of fibroid definitely will affect the chance of success. And then you have the endometrial polyps. So you can see the polyps. Polyps are tissues that grow inside the endometrium. They affect um, implantation. They affect IVF success. Um, because once you have something that is occupying the endometrium where the embryo should be, then the chance of success will be greatly reduced. So if during the evaluation of such patients we discover that there is endometrial polyp, the polyp must first of all be taken out and ensure that the endometrium is clean before the patient will proceed on the IVF program. Right? It's an ultrasound report showing the endometrial